All right, guys, welcome back. This is your professional practice concepts. So, what is professional practice? What is professionalism? So, again, kind of like nursing, everybody has their own ideas of what they think professionalism is. So, professionalism is defined as the commitment to conduct oneself with integrity according to the high standards of the nursing profession and to engage in lifelong learning to pursue excellence, advance nursing practice, and promote optimal health. Okay, so that definition was adopted from the National League of Nursing. And as a nurse, we're required to uphold all the commitments expected of the profession. So what do you guys think integrity is? Again, this is another word that many different people would be able to say many different things for. So the definition is that integrity is the quality of being honest and having strong moral principles and moral uprightness. So that is the perfect example of a nurse. So nurses have to have a lot of integrity. They have to be very honest, and you have to have very strong moral principles when you're caring for other people. And as nurses, we agree to become lifelong learners. We believe to always educate ourselves so that we stay up to date with the latest evidence-based practice and become educated and continue with our degrees that we are helping to advance the nursing practice so we are better able to provide and promote optimal health for our patients. So when you become a licensed practical nurse, you will continue, even if you decide not to become an RN, wherever you work, there will be meetings that you will have to go to and evidence-based practice things that you will be required to, you have different commitments to where you work. So for example, where I work, we have different committees that you have to join. So like a safety committee or a CLABC committee, or a quality committee, which is preventing central line infections and urinary catheter infections. So you're always continuously learning, and evidence-based practice is always changing. That's why we call it evidence-based. It's the latest. So as we learn more about things change. So we have to always keep ourselves educated, and by becoming educated, we are ultimately contributing to the advancement of the nursing profession. So the term professional implies that someone is competent and qualified to perform a specific occupation. Any nurse should be serious about the occupation and have a high level of integrity. You have to be very trustworthy, and you have to maintain high standards. For 18 years in a row, 85% of Americans stated that they believe that nurses are among the most honest and ethical of all professions. And I do believe that that is true, and that is exactly how you have to be as a nurse. And those are big shoes to fill, but you guys will be able to do it. The scope of practice is a phrase that's used to describe what tasks and duties members of a particular occupation are legally permitted to perform. For example, if you're caring for a patient on a medical surgical floor and he starts to decline and you need to call a rapid response, it might be determined when the rapid response team arrives that he needs to be intubated and upgraded to the ICU. So the nurse's scope of practice would be recognizing that the patient was decompensating and needed to be upgraded and contacting that rapid response. She would be administering any medications that the doctor told her to. She would be applying oxygen to the patient, hooking him up to a heart monitor, and transferring the patient to the ICU. She would not be able to intubate him. So intubation would be done by a respiratory therapist or a medical intensivist or a physician. So being able to intubate a patient is not within the nursing scope of practice, but it is in the scope of practice for a respiratory therapist or medical physician. So that's what I mean by scope of practice. And you will hear this throughout your career, what the scope of practice is. You'll get very familiar with that term. All right, so healthcare delivery systems. Healthcare delivery systems are the organization, it's just the organization of people, institutions, and resources that are used to deliver services to meet all the healthcare needs of any type of population. This includes the RN, it includes the doctor, it includes the nursing care tech, the patient's case manager, the respiratory therapist, physical therapy and occupational therapy. It takes a whole team to meet the needs of the patient. And they all work together and collaborate together in the best interests of the patient. So that brings me next to teamwork and collaboration. So teamwork and collaboration is the process of function effectively with nursing and interprofessional teams. They foster open communication. They have mutual respect for each other and a shared decision-making to achieve quality patient care. And that is adapted from CUSIN. You will need to know about CUSIN, and you'll hear a lot about CUSIN. So CUSIN is the quality and safety education for nurses. And it's a project that addresses the challenge of preparing future nurses with all of the knowledge, the skills, and the attitudes that they need to continuously improve the quality and safety of healthcare within which they work. They set standards, they create guidelines and incentives for nurses. All right, health ethics. So health ethics is the application of a systematic process which is used to identify and synthesize moral issues and for acting as moral agents with consideration of values, principles, and codes that shape personal and professional decision-making. Okay, I know that sounds like a lot. So in simpler terms, sometimes as nurses, we have to make decisions regarding patients, or we must watch decisions be made for patients that maybe we don't agree with or that don't benefit the patient. For example, the first 5 years I was a nurse, I was an oncology nurse, which I absolutely loved, and I still love it. I had a patient that was older, and she had a terminal cancer diagnosis. The patient had expressed to me several times throughout the day when we were talking that she was tired and that she was done with her treatments. She stated that they made her feel so sick every day and that she didn't want to spend her remaining days alive feeling so bad all the time. I encouraged her to speak to her family about it. She did, but they were not on board, and they put a lot of pressure on their mom to continue treatment. So in advocating for the patient, I contacted the doctor and had the doctor speak to the family, but that still didn't help. They didn't want to let up on the mom. They still encouraged her to keep taking the therapy. So unfortunately, we had to refer the case to the ethical committee at the hospital, and they got involved and they decided to help make the best decision for the patient. So, you know, oncology is kind of like a different field in itself. And family, you're going to encounter this a lot. And well, maybe not even just with oncology, but you're going to encounter family members that don't want to let their loved ones go. And that's a completely normal process. You don't want to let your loved ones go. You love them. Healthcare providers see it every day. They see it in a different, we see it in a different light because we see people suffer that shouldn't. We see things that we shouldn't. So we kind of have a different outlook on it, but we always have to try and think of where the patient's coming from, what's important for the patient. We want the patient to be able to live their life with dignity. I didn't believe at this time that this lady was living with dignity. She was miserable. She was getting chemo. She was sick all the time, and she was terminal. She was never, ever going to beat this disease. So what little time she had left was miserable for her. But the family was very selfish, but I understand with good reason because they loved her and they weren't ready to let her go yet. So it's very multifaceted and some things become tricky. So that's what I mean when I talk about ethical considerations. Sometimes you have to have an outside source come in and make these decisions because the family members can't. So you have to recognize when those decisions should be made and you have to advocate for your patients. All right, so health law. Health law is the system for ensuring the impartial treatment of individuals, and they provide consequences for those who deviate from established standards and regulations. For example, people who are negligent and harm others, nurses or doctors who steal medications, things like that. That's where you see health law. And then advocacy is just what you would think it is. It's the protection and support of another person's rights. So as nurses, you do a lot of advocating. You advocate for your patient. For example, I once took care of a woman who was really sick. I can't even remember what she had right now. I think she had pneumonia, and she was in the hospital for 6 days. She was really sick. And at the end of 6 days, they said she was all right to go home. And before her admission, she had lived at home by herself. She didn't use a walker. She didn't use anything, but she lived in a house that had 6 steps to get in. And then her bedroom and her bathroom, her shower and everything were on the 2nd floor. And that was another 12 steps, okay, to get up to her house. So physical therapy wasn't able to walk with her. She had a private doctor caring for her. He said she would be fine to go home. He saw her, he thought she was okay, and he discharged her. So when I was talking to the patient, I got up and I took her to the restroom, and she had a lot of trouble walking. And I was very hesitant to let this patient go because she couldn't even get 6 feet from the bed to the bathroom without me holding on to her. So how was this woman who lives alone, had 6 steps to navigate getting into her house and another 12 to get to her main floor where her bedroom and her bathroom are? These are necessities. So I called the doctor and I told the doctor that I didn't feel like the patient was ready to go home. I felt like she needed to be seen by physical therapy and occupational therapy, and that they needed to determine if the patient was ready to go home on her own or if she would be able to benefit from maybe a couple weeks stay in like just an acute care, like long-term care facility, something like that, where she could just get some rehab. So that's what I mean by advocating for your patients. You have to recognize opportunities to advocate for them and make sure that you always keep their best interests at heart. And you will always hear about advocacy. And you're going to hear all about these things forever in your entire career. So they're really important. So professionalism. Let's identify some professional behaviors. We're going to talk more about this when we actually do our live Zoom, because I want to try and get some input from you. And then we're going to also talk about some consequences of some unprofessional behavior. So you guys can write these down if you're listening to this lecture before we actually have our live Zoom. And then we will talk about it when we meet. So what determines a profession? So Abraham Flexner was an American educator. He was best known for his role in the 20th century reform of medical and higher education, not only in the United States, but also in Canada. In 1915, he developed criteria to determine what constitutes a profession. So he listed 6 things. Number 1, a profession is basically intellectual as opposed to physical, and it is accompanied by a high degree of individual responsibility. Number 2, professionalism is based on a body of knowledge that can be learned and is developed and refined throughout research. Number 3, a profession is practical in addition to it being theoretical. Number 4, a profession can be taught through a process of highly specialized professional education. Number 5, a profession has a strong internal organization of members and a well-developed group consciousness. And number 6, a profession has practitioners who are motivated by altruism, which is the desire to help others, and who are responsive to public interests. So, my thing doesn't want to move. Okay, here we go. So, is nursing a profession? What do you guys think? Nursing is a strong service orientation. We're dedicated to providing care for others. The emphasis is on critical thinking and on research to expand the knowledge base. There is autonomy in practice. We're listening to our patients and we're anticipating their needs so that we can advocate for them. And the American Nurses Association has developed a code of ethics and standards for nursing practice. We can talk more about this on the next slide. And there are a multitude of professional organizations. You have the ANA, which is the American Nurse Association. You have the NAPNS, which is the National Association for Practical Nurses Education and Service. You have the Oncology Society. You have the Society for Med-Surg Nurses. You have Society for Critical Care Nursing. And many nurses enter the profession with the desire to help others. So based upon that, I think we are in agreement that nursing is a profession. So nursing is a profession. Individuals in a profession have autonomy in decision-making, and they follow a code of ethics to help guide their practice. In a recent survey, RNs ranked highest among all professions for the highest professional standards of honesty and ethics. And I think that we talked about that earlier. So just a little repeat on that. So the American Nurse Association, the ANA, this is just a highlight of their code of ethics. So they require that nurses practice with compassion and respect. They require that the primary commitment is to the patient. They want to promote nurses to be advocates. We talked about that, to protect their health, the safety, and the rights of the patients. They want nurses to be responsible and accountable. They want nurses to collaborate with other healthcare professionals. So they want nurses to work with PT and the OT and the case managers and other members of the healthcare team to meet the needs of the patient. And they want them to maintain competence in their fields. So like I said earlier, joining those committees at work, furthering your education by becoming an RN, and then getting your bachelor's, and then maybe going on to get your master's or becoming a nurse practitioner. So these are all important highlights for the Code of Ethics. All right, the National Association for Practical Nurse Education and Services, NAPNS, is dedicated to promoting and defending the practice, the education, and the regulation of licensed practical nurses, which you guys will be in less than a year, or this time next year. So the licensed practical nurses, the licensed vocational nurses, and the practical nursing educators, practical nursing schools, and practical nursing students. NAPNS has constituent state members throughout the United States, in all the different states. So professional nursing organizations for practical nursing, there's the National Federation of Licensed Practical Nurses. So for licensed practical nurses and licensed vocational nurses and practical vocational nurses for students in the United States, this is for them. The NFLPN is their primary goal is to offer support and ongoing education to the LPNs and the LVNs who have obtained membership in their organization. They accomplish this through a variety of means, which include they offer continuing education courses, educational programs, special healthcare related events, recognition awards, and informational newsletters that they send out to all their members. So their mission is to foster high standards of nursing care and promote continued competence throughout education and certification and lifelong learning with a focus on public protection. So are you seeing a pattern here with education, lifelong learning? This is really important to the healthcare field. So the National Federation of Licensed Practical Nurses is committed to quality and professionalism in the delivery of nursing care, working with other organizations and groups in a cooperative, progressive spirit to build strong professional and public relationships. So professional organizations were created to deal with issues of concern for those practicing in their profession. So some common organizations that you will hear about are the National League for Nursing, and you have the American Association of Colleges of Nursing. You have the American Nurses Association, we talked about that a while ago. You have the International Council of Nursing, and then you have the National Student Nurses Association. So others focus on specific areas of practice, such as critical care nursing, nursing administration and research, nurse, midwives, and nursing education. And if you want to look on page 16, table 1-3 in your book has the expanded educational and career roles of nursing, and that's pretty interesting. I recommend you guys take a look at that. All right, so practical nursing programs were established to teach graduates to give bedside nursing. Programs were located in high schools, technical schools, community colleges, and independent agencies. They last a year in length. PNs work directly under the direction of a physician or a registered nurse to give direct care to patients. And the trend today is related classroom theory laboratory practice, and clinical experience by offering integrated sections over the length of the entire program. So basically, that's exactly what this year will be for you. You'll have some classroom theory, we'll have some putting all that we learn in the classroom into practice in the laboratory setting, and then you will also hopefully have some clinical experience to help piece all of that together. So nursing education, there's controversy over the educational of the entry-level nurses. Nursing education originated, like I said earlier, in the hospital. There were what we call diploma programs. So St. Joe's here was actually a diploma program, and that's where Dr. Sean McNamara, Dr. Cheryl McNamara's husband, graduated from. Today, most are educated either in associate's or a baccalaureate degree program. They don't have diploma programs anymore. So if you obtain a nursing degree, you get an associate's degree. That's a 2-year program. And then if you get your bachelor's degree, that program is actually 4 years after your prerequisites. So you take your prerequisites, and then you have 2-year and 4-year. Then we have master's and doctoral programs, okay? You can get a master's in education, a master's in business, and master's in leadership. There's many different paths that nurses can focus on for their master's and their doctoral programs. You could be a nurse practitioner, you could be a nurse midwife, a lot of different avenues. Graduation education allows for the registered nurse to specialize in an area of interest. And the LPM is a certificate program, which is not an associate's program, okay? So don't get those two confused. It's not an associate's program. Nursing education. So a master's prepared nurse is considered an advanced practice nurse. So advanced practice nurses can be nurse practitioners either in family, pediatric, women's health, or geriatrics. I'm actually in a master's program right now, a nurse practitioner program for the gerontology population, because I don't really want to help. I thought about doing family, but I don't really want to take care of children. There's a lot of differences in children and adults, so I like just focusing on adults. So you could always do that. You could be a certified nurse midwife, a certified registered nurse anesthetist, who puts patients to sleep like a regular anesthesiologist, but it's a certified registered nurse anesthetist. You can be a nurse researcher. You can be a nurse administrator in a hospital or a nursing home, a nurse educator, or a nurse psychotherapist. So there are a lot of opportunities for everyone to find something that they love to do in nursing. And I apologize because I did not hit the button. I didn't know that we were not on that slide. So I apologize for that. All right, so besides formalized education, it's imperative that nurses continue to learn. I keep saying that over and over and over again, but it's extremely important. Nurses can attend in-services in their facilities. They can participate in trainings that their employers have. Skills Day at their local hospitals. You will continue to learn through obtaining your BLS, your basic life support, and your ACLS. And education is listed in the ANA standards of professional practice and is a requirement. So the professional nurse needs to keep current on nursing practice and best practice, which is what we call evidence-based practice. So continuing education is formal, organized educational programs that are offered by universities, hospitals, and other professional nursing organizations. Continuing education keeps the nurse current on the latest research and provides the most up-to-date information on specialized areas of care. All right, regulation of nursing practice. This is a good slide. I think you guys really want to know the information on this slide because you might see it again, maybe on a test. Regulation of nursing practice takes place in a variety of settings. Institutions and organizations are at the national and state level that guide nursing practice, and there are standards of practice. So it defines activities that are specific and unique to nursing, okay? Standards of practice define activities that are specific and unique to nursing. It allows nurses to carry out professional roles, serving as protection for the nurse, the patient, and the institution where healthcare is provided. And each nurse is accountable for his or her own quality of practice, and they are responsible for the use of standards to ensure knowledgeable, safe, and comprehensive nursing care. So each state has their own state board of nursing. Here it is the Maryland State Board of Nursing, and each state develops their own nurse practice acts. So the Nurse Practice Acts regulates licensure and the practice of nursing for that state. And the NPAs, the Nurse Practice Acts, define the scope of practice for licensed, practical, and registered nurses. So nursing practice. This is also a very informative slide. You may want to make extra note of the things that are on this slide because you may see them again. The National Council Licensure Examination, the NCLEX PN or the NCLEX RN. So you have an NCLEX, which is for practical nurses, yourself, or registered nurses. So it is an exam that is the same in all states, that ensures a standardized minimum knowledge basis for nurses, practical nurses and registered nurses. So beyond NCLEX, a nurse may choose a certificate in a special area of nursing. So when I graduated nursing school, I had to take the NCLEX RN, which was a test that ensured that I had a standardized minimum knowledge base for me to become a nurse. Once I passed that and I became a nurse, then I could pursue other avenues and other specialties, which I did. I decided to become an oncology nurse, and I was a certified oncology nurse. So that's what I mean by you can choose a certification in a specific area of nursing. So what you do after you complete your program, you'll get an authorization to test. You will take your exam. The exam measures your knowledge of nursing practice in several areas and requires that you retain information that you were taught during this educational program over the next year. And then the nurse maintains the certification by continuing education and clinical practice. And then the Maryland Board of Nursing is responsible for making sure that you stay current on those. So also another important slide, this is the Board of Nursing. So they have the authority to issue licenses and the right to revoke or suspend them for a variety of reasons. So duties include evaluating nursing programs, and they develop nursing standards for those programs. And they want to make sure that nurses are working within their scope of practice. And we did give some examples earlier of what the scope of practice was. So like I told you, you're going to be hearing that term a lot. All right, so disciplinary sanctions. So examples of offenses include where you could lose your license would be certain mental or physical illnesses, the conviction of a felony, any type participating in fraud or the deceit in obtaining a license, conviction of a crime involving moral turpitude or gross immortality, willful neglect of a patient, negligence in the care that you provide for your patients, habitual use of or chemical dependence on drugs or alcohol, violations of the nurse practice law in the state, and if you have suspensions or if you have a suspended or revoked license in another state. All right. So professional roles and responsibilities. This is also some important information that you will see again. The nurse must be prepared to take on several different roles depending on the healthcare setting and the changes in the healthcare needs of the population that's being served. For example, your job includes many different tasks. You will give baths, you will assist with toileting, you will administer medication, you will offer education, and you will recognize opportunities to advocate for your patient. So you are doing a variety of roles when you are becoming a nurse and you are taking care of people. Okay. So more important information. So the caregiver is considered, they help the patient regain health through the healing process. They are an advocate. They protect the patient's human and legal rights, and they aid in asserting those rights. The nurse is also an educator. They explain to patients the concepts and facts about health. They demonstrate procedures like teaching them how to take their medicine when they go home, how to do their insulin when they go home, if they have to start taking insulin, how they're going to do their injections, if they have a catheter, how they would want to empty their Foley bag. They reinforce learning to make sure that they're capable of doing these things when they go home. And then they evaluate the patient's progress in learning. So education is a huge role for nurses. And they're also collaborators. So they work with other people on an activity or projects, or they work with other members of the healthcare team to achieve the goals of the patient. So professional roles and responsibilities. So nurses are communicators. That involves communication with not only the patients, but you're communicating with their families, their loved ones, other nurses and healthcare professionals in the field, resource persons, and people in the community. So you are communicating with a variety of people to help manage the needs of your patients. You act as a manager, you coordinate the activities of other members in the healthcare team, and you're also a clinical decision maker. So you're using the critical thinking skills that you're taught throughout the nursing process to provide effective care for your patients. So nurses or clinicians, they provide direct patient care, right? We talked about that. They are nurse administrators, so they manage patient care and the delivery of specific nursing services within a healthcare agency. You have nursing researchers who investigate problems to improve nursing care, to gain that evidence-based practice, and to further define and expand the scope of nursing practice. And then you have nurse educators who work primarily in schools of nursing, staff development in the healthcare agency, and patient education departments. So I would be considered a nurse educator. You have clinical instructors who take you into the clinical field. They're considered nursing educators. Then you have educators that just work in the hospital that educate the staff about different skills. And then you're an educator because you're going to be educating your patients on a variety of different topics. So there's many, many, many opportunities in nursing. Not everybody likes the same thing, and that's great, because if they did, there would be a lot of jobs for certain fields that no one likes. So you can be a hospice nurse, which I absolutely love. That is going to probably be my specialty once I become a nurse practitioner. I would most like to be in oncology or be a hospice nurse and work like in palliative medicine with the hospice patients. They're just a wonderful, wonderful group of patients. You can be an informatics nurse specialist. You can be an occupational health nurse. You can be a quality manager. You could be a flight nurse, a telephone triage nurse, which that career in itself has just really taken off with COVID and doing all these telehealth appointments. There's a big need for that right now. You can do forensic nurses. I know a lot of people who love that. You could be a school nurse. You could be a travel nurse also. I'm sure you've heard that they are making big time money right now because there's a nursing shortage, and these states who are really inundated with COVID need nurses. So these nurses are making upwards of sometimes $6,000, $7,000 a week to go and agree to stay somewhere for 6 to 12 weeks and be a nurse for a couple days a week. And then there's also a parish nurse. So healthcare delivery systems and the healthcare team. Another important slide. So the healthcare team is made up of a diverse group of individuals who ultimately share a common goal. And that common goal is ensuring that the patients that you're taking care of, the clients and residents, receive excellent health care. Okay, we talked about that earlier. So who is the members of the healthcare delivery team? So you have the nurse, so the registered nurse and the practical nurse. You have the nurse practitioner. You have physicians and physician's assistant. You have dentists, psychiatrists, psychologists, podiatrists, optometrists, and then you have unlicensed assisted personnel like patient care techs and nurses' aides. So these are all, and there's more people than that. You're going to have physical therapists, occupational therapists. They each have assistants. There's the pharmacist, the dietitian, the respiratory therapist, the social worker, and the chaplain. So on any given day, you could work with at least, it would not be impossible for you to work with like 10 other people. So you take care of your patient every day when you come in, and then physical therapy and occupational therapy want to work with them. So you're going to talk to them and meet and set up a time that works with you and them so that they can see the patients. And then you're going to call down to dietary and order your patient's meals. So you'll be talking to them. And then maybe your patient is on nebulizer. So you're going to contact respiratory therapy to make sure that they come and give them their treatments. You might have a patient who's very religious and who wants to get, some kind of spiritual service. So you're going to talk to the chaplain. And then, maybe your patient came in because they have a foot injury. So you're going to be talking to the podiatrist while you're there. You're going to be communicating with your techs all day. Maybe the doctor has a nurse practitioner that works for them and takes care of the patients in the hospital while they're out back in their office doing work. So that's a normal day in a hospital for you to speak to all those people. So it's really good to recognize who your team members are and always have a great line of open communication. So interprofessional communication. Interprofessional education occurs when students from 2 or more professions learn about, from, and with each other to enable effective collaboration and improve health outcomes. Once students understand how to work interprofessionally, they're ready to enter the workplace as a member of a collaborative practice team. This is a key step in moving healthcare systems from fragmentation to a position of strength. And that makes sense because we all have to know how to work together to have one good unit to take care of patients. So healthcare delivery systems, where do we see healthcare given? Well, you have primary healthcare centers, right? That includes the diagnosis and treatments of minor illnesses. So examples of primary care settings are clinics like your Patient Firsts, physicians' offices. Then you have hospitals. You can have inpatient where you go and you stay for a couple days. And then you have outpatient. So maybe you will just go see a doctor in the outpatient setting, or maybe you'll have a procedure that's in the outpatient setting. So you have extended care, which provides medical and non-medical care for people with chronic illnesses or disabilities. So that would be like your nursing homes. And then you have specialized care centers. So you have daycare for older adults. You have mental health care facilities. You have schools, industries, rehabilitation, and parish nursing. Healthcare services for the seriously ill and dying. So there's a couple different things. So they have something called respite care. So respite care is a service that is provided for the seriously ill, or maybe a person that's dying, but it benefits the patient and it benefits more so the caregiver. So being a caregiver, and you'll learn a lot more about this, is very overwhelming. Everybody has their own situation that they're going through. Not everyone can just stay home and take care of a loved one. Maybe, if we could use the example of the husband and wife who got married and they have 3 small children, 2, 7, and 9, and the husband got pancreatic cancer and he's terminally ill. And they are not independently wealthy. They cannot afford to just stay home and not work. And the wife still has to continue to work, and she's trying to take care of her husband because she has to keep health insurance because he has all these treatments that he's getting. And now he's not working and she's working 1 or 2 jobs to make up so that she can keep their family together in their house. And it's very hard and overwhelming to be able to take care of your loved ones. Doesn't mean that you don't love one. It doesn't mean you don't love them. It just means that it comes at a cost, and it can be very hard. So respite care would give the wife an opportunity to bring her husband into a facility, kind of like a nursing home, but not necessarily long-term care, to stay for a week or maybe 2 weeks to give their loved one a break. Because if your loved one can't take care of themselves, if the loved one can't take care of themselves, then they can't provide care for their loved one either. So respite care is a great option for people who are taking care of their loved one. Then there's hospice, Okay, so hospice can be inpatient in a facility, or it can also be in the patient's home. And they basically encourage the patient to live comfortably according to whatever they want. It's all driven by the patient. It all follows their wishes. It makes sure that their rest of their time here and their death is dignified. It encompasses all of their goals and what's important to them. And it does include some palliative care. So palliative care, people associate palliative care with hospice, and they're actually two completely different things. So when you educate your patients about palliative care, they might shut you down right away and say, no, I don't want to do that. I'm not dying. So palliative care is a specialized medical care that focuses on providing patients relief from pain and other symptoms of serious illnesses, no matter what the diagnosis or the stage of disease is. The goal of palliative care medicine is to improve the quality of life for both the patients and their families. And this form of care is offered alongside curative and other treatments that the patients could be receiving. So healthcare delivery is the responsibility of the federal, state, and local government. The state government is responsible for administer programs such as the state health department, licensing boards, and the licensures of hospitals and healthcare facilities. The federal government has numerous agencies in place to help oversee the delivery of healthcare in the United States. The public health service agencies are under the Department of Health and Human Services. And some of these agencies that you may have heard of include the CDC. I know you guys have heard a lot about that lately with all the COVID stuff, and that is the Centers for Disease Control. You have the FDA, which is the Food and Drug Administration. You have the NIH, which is the National Institute of Health, and then you have CMS, which is Center of Medicare Systems. Okay, so the Joint Commission. You guys are always going to hear about the Joint Commission. I'm sure you've probably even seen these memes on Facebook about the Joint Commission. So the Joint Commission, what is it? The Joint Commission provides voluntary accreditation of hospitals and healthcare organizations. It assures standards of care are met at a national level. The mission of the Joint Commission is to continuously improve the safety and quality of care provided to the public throughout the provision of healthcare accreditation and related services that support the performance improvement in healthcare organizations. So, let's see. So an example of the national safety practice is, so JCO, let me just back up a little bit. So this, first of all, is important information. You're going to want to know this because you're going to see it again. There are many areas that JCO looks at. We call it JCO for short, the Joint Commission, that JCO looks at and determines goals for. So they update and revise goals on a yearly basis. For example, it has on its website the National Patient Safety Goals for hospitals. And some of those goals may include improving the accuracy of patient identification, which we know is important for many reasons, keeping the patient safe, administering the right medications. They have a goal of improving the effectiveness of communication among caregivers. And then they might have a goal of improving the safety of using medications. So some examples would be the use of wristbands for identification of the patient, making sure that the patient has the right wristband that has the right information on when they come in the hospital, scanning that wristband to make sure that we're scanning the patient so that all the balances and checks are in place to make sure we're giving the right medication. They provide strategies to prevent medication errors, such as avoiding abbreviations for medications and scanning patients, like I just said. And they also, they want to make sure that communication is fluid. So an example would be in the OR when you're doing that time out. You know, that everybody stops and takes a minute and they talk about who the patient is, they talk about what the patient is here for, and they mark on the right body part what they're actually going to be doing. And then on the med search floor, an example of that would be the communication would be a bedside shift report that nurses give at the beginning of their shift to the oncoming nurse, and at the end of the shift to the next oncoming nurse. So healthcare reform. The healthcare reform, some of the topics we're going to talk about are patient protection and the Affordable Care Act. I'm sure you guys have heard a lot about that. That actually became a law March 23rd of 2010. It was intended to expand coverage, control healthcare costs, and improve the healthcare delivery system. It allowed young adults to stay on their parents' health care until the age of 26. I think before this was enacted, the age was 23. And then insurance companies were no longer able to deny anyone coverage because of a pre-existing condition. That was huge. So before this, insurance companies, say you had breast cancer when you were 22, you had a mastectomy, you had it taken care of, you're completely fine now, clean bill of health. When you get married and go onto your husband's insurance, they could say, nope, we're not accepting you because you had cancer when you were 22. So now with the Patient Protection and Affordable Care Act, insurance companies can no longer do that. And they also cannot cancel coverage because of the onset of a new condition. So that's important to know. So healthcare reform still, individuals will be required to get coverage, or you have to pay a fine if they don't. So everyone in the United States has to have healthcare coverage. And if you don't, you get a fine, and they assess it on your taxes each year. Most employers are required to provide coverage or pay a fine if they don't, although there are exceptions for small businesses that usually have less than 50 people. Healthcare coverage is expected to have expanded to an additional 32 million people by the end of 2019, and to cover 95% of non-elderly U.S. residents. Many insurers are required to cover certain preventative services that are at no cost to you, and nurses can help shape healthcare reform by supporting legislation to help improve healthcare. So this is important. You want to know that nurses can help shape healthcare reform by supporting legislation to improve healthcare. So you will notice that in Annapolis, they have a lot of hearings up there about healthcare and reform, and nurses go up there all the time to advocate for the profession and for healthcare reform. The exchange. So the exchange, the healthcare exchange also is called, you might have heard it called marketplaces, where you can buy a healthcare insurance plan for individuals and families. It is run by the federal government, and it was set up by the Affordable Care Act, also known as Obamacare. I'm sure most of you guys have heard of that. What they do is they make it easier to see what plans are available in an area. You can compare them and then make a purchase. It's a new way to shop and compare healthcare coverage plans. There's financial help for individuals and families based on income. It's not for people who have health coverage, so Medicare, Medicaid, TRICARE, or benefits through the Veterans Administration. And it's not for people with employer coverage, except where the employer plan is considered unaffordable, or inadequate. Pay for performance. Pay for performance is a strategy using financial incentives that reward providers for the achievement of payer objectives, including delivery efficiencies, submission of data, and measures to the payer, and improved quality and patient safety. So this is also known as P for P, pay for performance. It encompasses the idea that providers should be paid for medical services based on the quality of service they provide, not just the fact that they said they provided it. They want them to provide a high quality of care, and they want their fee to be determined by the care that they provide. So it incorporates measurement points such as patient engagement, patient satisfaction, care coordination, and healthcare outcomes. Everything is driven by money. You will learn that. The National Committee for Quality Assurance developed the Healthcare Effectiveness Data and Information Sheet. It was designed to allow consumers to compare health plan performance to other plans and to national or regional benchmarks. Although not originally intended for trending, HEDIS, which is the National Committee of Quality Assurance, results are increasingly used to track year-to-year performance. Strategies to reduce healthcare costs. One of the most significant factors that influenced payment for healthcare was what they called the prospective payment system. It was established by Congress in 1983 and it eliminated the retrospective payment system, which was a cost-based reimbursement. Their prospective payment system had Medicare patients bundled into what they called diagnostic related groups, DRGs. Each group has a fixed reimbursement. A DRG, or a diagnostic related group, is how Medicare and some health insurance companies categorize hospitalization costs and how they determine how much to pay for a patient's hospital stay. So rather than paying the hospital for each specific service that was provided, Medicare or a private insurer will pay the hospital a predetermined amount based on the patient's diagnostic related group. So for example, a patient has a total hip replacement and the insurance company is allowing $7,800. If the patient stays for 1 day or 4 days, they get $7,800. If they end up going home and being readmitted from an infection from that injury, the hospital still only pays the $7,800. They won't pay for a readmission due to an infection that was caused, from a previous admission. Strategies to reduce healthcare costs. So under the prospective payment plan, a healthcare provider will receive a set rate of reimbursement regardless of the length or services provided. The plan made hospitals and other healthcare providers realize that control cost is extremely important. And this system made hospitals more competitive, and it also shortened the length of stay, and discharge and planning activities increased. So it used to be when, like back in 2003, I had my son and I had him via C-section. So back then it used to be you could stay for 5 nights. That's what they allowed. Well, now things have changed and most hospitals only allow 3 days. Why do you think? Well, you're still going to get the same amount of money whether you stay 3 days or 5 days. But if you send a patient home earlier, well, that opens up a bed for other patients to come in and they are able to make more money. So capitation. Capitation is when the insurance company pays the provider a set payment each month to provide a defined set of healthcare services. Managed care is healthcare systems in which the provider receives a predetermined capitated payment for each patient enrolled in a program. The organization assumes financial risk in addition to providing the care, and the focus is usually on prevention, early prevention, and outpatient care. So paying for healthcare. How do we pay for healthcare? Many different ways. So we can pay out of pocket. Okay, you just decide that you don't feel good today and you're going to go to the doctors, so you will just pay out of pocket. You can have individual private insurance, so the members pay a monthly premium either by themselves or in combination with the employer payments. So the employer will pay a certain amount and then you'll pay a certain amount. Sometimes the employer pays the entire benefit, which is a great benefit. Premiums do tend to be a little bit higher, and members can choose their own physician and their services that are desired, which is nice. People like to have flexibility with their health care. So employer-based private insurance, employers offer group insurance to employees and their families. There's government financing, so you have Medicare and Medicaid. So I used to always get those two confused. So Medicare is, we care about the old people, is how I think about it. So Medicare is for your people who have retired. So we care about the old people, Medicare. Medicaid has the word aid in it, and it means that we are giving aid to people who need help. So these would be like your assisted, your medical assistance plans and things like that. So that's how I remember those two. So hopefully that will be helpful for you. Then they have the Children's Health Insurance Policy, also known as CHIP. And then the Veterans Health Administration, also known as the VA. I'm sure you guys have probably heard about the Veterans Health Administration. So that is for the people who have served our country in the Army or wherever they have served. They get lifelong insurance, which is just a drop in the bucket to repay them for what they've done for us in our country. So Medicaid, talked about that, right? People who need aid, also known as medical assistance, provides public assistance for health care benefits. Medicaid is paid out of our general taxes for people who require financial assistance. It is paid by both federal and state money, and each state program is unique to that state. Eligibility is based on your income, and some disabled people may qualify. Medicare, we care about the elderly, so Medicare covers people 65 and older and people who have kidney failure or other selected disabling conditions. The patient pays a deductible and a coinsurance. So, for example, they might have a deductible of $500 a year. So what that means is that the insurance company will agree that they're going to pay 80% of certain visits to doctors, but they're not going to start paying that 80% until you've paid the first 500. So if you go to the doctors for your yearly flu vaccine and just a physical, you're going to be responsible for paying that portion. And maybe you're going to have to pay for your labs and things like that until you reach that $500 mark. Then when you reach that deductible, then your insurance will kick in with that co-insurance, and then they will pay 80%. And then you would pay the other 20%. And again, those numbers can vary. I'm just using those as examples. So there's two types of Medicare. There's Medicare Part A, which covers the disabled and those that are 65 and older who require hospitalization, home, and hospice care. Medicare Part B is voluntary, and it provides partial coverage of doctor services for people eligible for Part A. It'll pick up the difference. All right, 50s, quality and safety education for nurses, the Institute of Medicine, QSIM, we talked about that a little earlier, and then the Institute of Medicine is the IOM. So these address the challenging and the preparing future nurses with the knowledge they need, the skills and attitudes that are necessary to continuously improve the quality and safety of the healthcare systems in which they work, and which ultimately improves the quality and safety of the healthcare that they provide. So you will also hear about these a lot throughout your career. These are called QSIM competencies. This is an important slide again. So whenever I say that this is an important slide, you might want to know it, because you will probably see it again on a test. So QSIM competencies. Some of the competencies that they have determined that are important are patient-centered care, teamwork and collaboration, evidence-based practice, quality improvement, safety, and informatics. So patient-centered care. So patient-centered care requires that we recognize the patient or designee as the source of control and a full partner in providing compassionate and coordinated care based on respect for the patient's preferences, values, and needs. So this, if I can use the example that I used before about the patient that I took care of, who was really not in control of her healthcare treatment plan at that time. That really wasn't patient-centered care because her family was so controlling. So as the nurse, you need to recognize that the patient is in charge of their treatment. Okay, they are in control. You have to help them provide the care that is based on their preferences, their values, and their needs. So you have to listen and anticipate what's going to happen and make sure that whatever care you provide, that they are always the center of that care. So examples other than that would be maybe recognizing that your Jewish patients request to maintain a kosher diet, and that they have allotted times for prayers during the day, and that they're able to schedule PT and OT tests around their time of prayer because it's very important to them. And then another example would be understanding that Jehovah's Witnesses do not accept blood transfusions. Jehovah's Witnesses can donate their own blood for storage before a surgery, but they cannot accept the blood from another person. That is against their religious beliefs. So those are all ways that we make sure that the patient stays in the center of their care. So teamwork and collaboration. Teamwork and collaboration states that you must be able to function effectively within nursing and interprofessional teams. You have to foster open communication. You have to provide mutual respect, and you have to have a shared decision-making to achieve quality patient care. We must be able to work together with other members of the healthcare team for the common good of the patients, and we have to help accomplish the patient's goal of treatment. So again, PT, OT, the dietitians, respiratory therapy, nurse practitioners, and physician assistants. All those people are part of our teamwork and collaboration. And we have evidence-based practice. We've talked some about that. So evidence-based practice is integrating the best current evidence with clinical expertise and patient family preferences and values for the delivery of optimal healthcare. So evidence-based practice, simply stated, is the practice that has been proven to actually work and efficiently produce desired results. So examples of evidence-based practice are when I was first orienting as a nurse, it was best practice at the time that before we use a patient's peripheral IV, that we checked it for blood return. And if it didn't have blood return, then they wanted us to change it out. And if it did have blood return, we would change the IV out every 3 days. Well, evidence-based practice states now that that IV does not have to be checked for blood return as long as it flushes and there's no sign of infiltration or any redness or swelling in the arm anywhere or wherever the IV is placed, that you can continue to use it. And you also do not have to change it out every 3 days now. It is good for the entire length of stay as long as there's no leaking blood that comes out and the dressing's not ugly, there's no redness, anything like that. So evidence-based practice changes all the time. That's why we are always learning, because we want to always be able to deliver that highest level of evidence-based practice care to our patients. So safety, I'm sorry, let's see. Quality improvement, I missed a slide, sorry guys. Quality improvement. Quality improvement uses data to monitor the outcomes of care processes and uses improvement methods to design and test changes to continuously improve the quality and safety of healthcare systems. So examples in the healthcare setting can be what we call safety event reporting systems. So where I work, we have something called Quantros, and that is a safety event reporting system. So what happens is you can go into, if you recognize something that occurred to a patient or in the healthcare setting that could have caused or did cause harm to a patient, you would want to enter it into this system. You could enter it with your information, your name and your employee number, or you could do it anonymously if you don't want to be, if you don't want anyone to know you did it. So the intent, we also call this like a just culture. So we encourage this at the hospital, and we encourage people to enter events that they see, because when we find out about these events, we can make changes. We can figure out what did happen versus what should have happened, and what do we have to do in the future to make what needs to happen happen. So it's not a reporting system to get people in trouble. That's not what it's all about. It's just to continuously improve the quality of the care that we give our patients. Safety. Now we're on to safety. So safety minimizes risks of harm to patients and providers through both system effectiveness and individual performance. So when we do meet for our live Zoom meeting, we are going to name some ways that we can minimize risks to our patients. Informatics. Informatics is the use of technology and information to communicate, manage knowledge, mitigate error, and support decision making. Trends in nursing care. So different trends that we see in nursing care are interactive learning, collaborative learning, competence-based learning. So your interactive learning would be things that you can do online, okay, with different programs. Your collaborative learning would be, getting together for that safety committee and working together to determine evidence-based ways to, prevent certain things from happening in the hospital, like falls and CLABSIs and CALDIs. Competence-based learning would be your online learning modules that your hospital makes you take each year. There's flexible education, technology, think community-focused trends. We have patient-centered care. We've talked about that. Diversity in healthcare, ethical concerns, terrorism. Unfortunately, we live in a time now where that is a very important topic, and we need to know about that. And then also increasing professional and personal responsibilities. So issues in healthcare. Nurses recognize the changes in healthcare. So they notice that patients are more acutely ill. There are shorter stays in the hospital for various reasons that we talked about earlier. More chronic illnesses, okay? What I mean by chronic illnesses are diabetes, kidney disease, high blood pressure, high cholesterol. We have an acutely ill, chronically ill health population today, more so than ever. We also have an aging population. We focus on health promotion and wellness, not just the treatment of these chronic illnesses. Okay. So the future of nursing. So employment of licensed practical and licensed vocational nurses is projected to grow 25% from 2012 to 2022. We're only 2 years away from that. Much faster than the average for all other occupations. As the baby boomer population ages, the overall need for healthcare services is expected to increase because they are living longer. Then you have your LPNs and LVNs, which will be needed in residential care facilities and in-home health care environments to help care for geriatric patients. So licensed practical nurses and licensed vocational nurses work in a variety of settings. They can work in nursing homes, they can work in extended care facilities, they can work in some hospitals, physicians' offices, and they can also do private home care. The starting salary, you guys, look at this, is $41,540 to $61,700. That's the potential that you guys can make, which equivalates out to $18 to $32 an hour. That is an excellent salary, in my opinion. So according to the Bureau of Labor Statistics, employment projections from 2012 to 2022, released in November of 13, listed registered nursing among the top occupations in terms of job growth through 2022. The RN workforce is expected to grow from 2.71 million back in 2012 to 3.24 million in 22, which is an increase of 526,000 people, or an average of 19%. So now we're going to talk a little bit about advocacy. So in the CCBC nursing program curriculum, advocacy is defined as the active support of patients to obtain the highest quality of health care. And I did give you the example of advocacy earlier when I had to advocate for the patient who wasn't ready to go home. She couldn't take care of herself because she had to walk with a walker because she was weak. So that's a great example of advocacy. As an advocate, the nurse protects the human and legal rights of the individual, of the patient that you're taking care of. And most nurses, when thinking about advocacy, just think of it as protecting the patient's right, but it's actually an ethic of practice. And it is in your nurse, in your code of ethics, that you must be an advocate for your patient. So in advocacy, your primary commitment is to the patient. You always support the patient and the family, but your job is primarily to be committed to the patient. Prioritization of good and individual patient rather than society in general. You want to prioritize the evaluation of competing claims of patients' autonomy and patients' well-being. You want to be a representation of patients. You want to promote self-determination. There's whistleblowing, which is speaking up and seeing something when you see something is wrong. And then being politically active, okay? A little more about advocacy. Ethics is the foundation of nursing practice. We already talked about that. There's even a code of ethics. We talked about that. So it is the foundation of all your nursing practice. Provision 3 of the American Nurses Association Code of Ethics for Nurses states that the nurse promotes, advocates for, and strives to protect the health, safety, and rights of the patient. And that is absolutely true. Those are your goals when you're taking care of patients. Nurses also advocate for the nursing profession. They advocate for quality health care by supporting appropriate legislation. And it's important to reach out to individuals in the community to make them aware of all the wonderful opportunities that there are in nursing. And there are a lot of them. So, advocacy. They present a positive image of nursing. Registered nurses ranked the highest among all professions for the highest professional standards of honesty and ethics. We just talked about that a little earlier. The media is also a big influence on the public's perception of nursing. So Johnson & Johnson has promoted the caring side of nursing in a very positive way, along with importance of nurse educators. They have some commercials and things like that running. Whoops. Sorry, guys. All right, so we will talk about this this practice question here when we are doing our live lecture. Now we are going to talk about caring a little bit. So caring probably means something different to each of you. Caring is just basically displaying kindness and concern for others. It's the work or practice of looking after those that are unable to care for themselves, especially the sick and elderly people. So the idea of person-centered care emerged about 30 years ago, and it was developed in an attempt to get back to holistic care of patients. Hospital consumer assessment of healthcare providers and systems have created a patient experience of care survey, which evaluates the care based on patient's perspective. So hospital consumer assessment of healthcare provider services is a lot to say. So in short, we call it HCAHPS. You will hear a lot about HCAHPS. HCAHPS, patient satisfaction in these care surveys determine the amount of money that facilities make. So the happier your patients are, the more money you get. So this patient experience of care survey, if you were ever a patient in the hospital and you got discharged, a couple days after you were discharged, you got a letter in the mail asking how was the care that we provided to you. And if that care is good, you're going to get paid more money. So that's why hospitals want to keep their patients safe. So we have a couple things here about caring. There's a couple different theories of caring. You can refer to table 10-1 on page 200 of your book. So there's Benner, who her theory was the helping role of the nurse, which believed that caring is central to human expertise, curing and healing, that it's necessary in order for patients to heal. There's Swance's caring process, which is a nurturing way of relating to a valued other toward whom one feels a personal sense of commitment and responsibility. And then there's Watson's curative factors, which is basically nursing is concerned with promoting and restoring health, preventing illness, and caring for sick people. So the professional nurse, what type of personal attributes should the professional nurse have? So some of the ones that are most important for you to have are open-mindedness. So everybody thinks differently, everybody feels differently. You may not share the same attitude about something that your patient does. You don't have to agree with what they believe in, but you do have to be open-minded and you do have to listen to them and you do have to respect their wishes, okay? Personal attributes, you should have a profound sense of value of the person. You should have a self-awareness and knowledge of your own beliefs and values. And the example I like to use for this is it's okay for you to have your own beliefs. Your beliefs are your beliefs. And like I said a couple minutes ago, you don't have to have the same beliefs as your patient, but you need to be aware of what your beliefs are and determine if they are going to interfere with the care that you provide patients. So if you are a huge pro-life advocate and you don't believe in abortion, you probably will never want to work as a nurse or a practical nurse in an abortion clinic, because that would definitely conflict with your own beliefs. So that's a good example of that. You should have a sense of personal responsibility for your actions. Okay, being a nurse or a practical nurse comes with a huge set of responsibilities. And if you make a mistake, you have to be responsible for your actions. That's a great life lesson and a lesson for being a nurse. You have to be motivated to do what you do to the best of your abilities. You should have good leadership skills. And you should have bravery to question the system. So, you know, sometimes you're put in a situation where you're the last stop before, you know, the patient and the doctor. And I use that example again of the patient that I sent home. You know, I was only off orientation 3 or 4 months when I had to confront that doctor. And I'm not going to lie, I was terrified. I wasn't sure if that was even in my, you know, was I able to do that? Could I question what the doctor said? The doctor must know better, right? He's been a doctor for a lot longer. I've only been a nurse for 4 months. These are the things that were going through my head. I just didn't have the experience or the confidence behind me. But what I knew in my heart of hearts was that, what would I want someone to do if that was my mom? You know, what if I lived in another state and my mom was sick and I thought she was fine and I didn't know that she couldn't go home on her own? I would want that nurse to investigate and talk to that doctor and question him about whether or not that patient should go home. So knowing to be brave and to question, you know, what you think doesn't feel right. And lastly, so the professional nurse. Professional nurse should have a good knowledge base, right, which you're going to get through this program. You should have blended competencies. So you should have a group of competencies that include critical thinking. You're going to learn critical thinking, which helps you think like a nurse. You're going to hear me say that a lot, think like a nurse. You want to have technical competencies, which are the skills you're learning in lab and clinical. You're actually hands-on stuff. You want to have interpersonal competencies, which helps you communicate with other members of the healthcare team. So your communication and things like that. And then you want to have ethical and legal competencies. So what are ethical issues? What are legal issues? What do I do if I have an ethical issue? All those things. So you want to have, as a professional nurse, a good knowledge base and all of those competencies, which you will have at the end of this 1 year. So this time next year, you will have all those competencies.